Before we begin, a quick note. Unlike many of the events we cover on this channel, the COVID-19 pandemic is part of our own recent history. Most of us lived through it. We remember the lockdowns, the empty streets, the face masks, the uncertainty, and the lives that were forever changed. This documentary is not just about facts and dates. It's a reminder of what the world went through, how it all began, and how a single outbreak grew into a global pandemic that affected nearly every person on Earth. Now, let's go back to the final days of 2019, when a mysterious illness in one city would change the course of modern history. In the final days of December 2019, doctors in a city in central China began noticing something strange. A cluster of patients with a severe pneumonia that did not respond to normal treatment, and that did not match any known illness. Within weeks, that mysterious illness would have a name, a genetic code, and a foothold on every inhabited continent on Earth. Within months, it would shut down schools, close borders, empty city streets, and kill more people than any pandemic in a century. This is the story of COVID-19, how it began, how the world responded, and the people at the center of the fight against it. From the doctor who tried to warn the world, to the scientists who built a vaccine faster than any in human history. The story begins in Wuhan, a sprawling city of 11 million people in China's Hubei province, an industrial and transportation hub, often called the Chicago of China. In late December 2019, physicians at hospitals across the city began treating patients suffering from an unexplained viral pneumonia, many of whom had a connection to the Wuhan seafood wholesale market, a large market in the city that, despite its name, sold a wide variety of live and dead animals alongside seafood. Among the doctors who noticed the pattern early was Wenliang, a 33-year-old ophthalmologist at Wuhan Central Hospital. On December 30th, 2019, Li sent a message to a private group chat of fellow physicians, warning them of what he described as a virus resembling SARS, the severe respiratory illness that had caused a smaller but frightening outbreak originating in China back in 2002 and 2003, urging his colleagues to take precautions. That message, intended as a private warning among medical professionals, was screenshotted and spread rapidly online. Within days, Chinese police summoned Wenliang and reprimanded him for, in the words of the official document he was made to sign, spreading rumors and disturbing public order. He was forced to sign a statement acknowledging his conduct was inappropriate and unlawful, and returned to work. Weeks later, Li himself contracted the virus, apparently from a patient he had treated, and on February 7th, 2020, he died in the very hospital where he had worked at just 33 years old. His death sparked an outpouring of grief and anger across Chinese social media, with many citizens openly criticizing the government's initial handling of his warning in a rare and significant moment of public dissent. And he is remembered by many today as the whistleblower of the pandemic. Chinese authorities formally notified the World Health Organization's country office on December 31st, 2019, of the cluster of pneumonia cases in Wuhan. In the first weeks of January 2020, scientists in China worked to identify the pathogen responsible, and on January 7th, announced they had identified a novel coronavirus, a family of viruses that includes both the common cold and more severe illnesses like SARS and MERS. This new virus would eventually be officially named SARS-CoV-2, and the disease it caused would be named COVID-19, short for Coronavirus Disease 2019. Chinese researchers, led by virologist Zhang Yongzhen and his laboratory, sequenced the virus's full genome within days and published it publicly on January 11, 2020, an act of rapid scientific transparency that allowed laboratories around the world to immediately begin developing diagnostic tests, even as broader questions about the outbreak's true scale and the timeline of human-to-human transmission in China remained clouded by delayed and, in the assessment of many international observers, insufficiently forthcoming official reporting in those crucial early weeks. The virus did not stay contained to Wuhan for long. Thailand reported the first confirmed case outside China on January 13, 2020. The United States confirmed its first case on January 21st in a resident of Washington state who had recently traveled from Wuhan. On January 23rd, Chinese authorities took the extraordinary step of placing Wuhan under a strict lockdown, cutting off travel in and out of a city of 11 million people, a measure without real precedent in the modern world, soon extended to much of Hubei province, affecting some 60 million people in total. The World Health Organization declared the outbreak a public health emergency of international concern on January 30th, 2020, its highest level of alarm short of formally declaring a pandemic, a distinction that would come 6 weeks later, on March 11th, 2020, when WHO Director General Tedros Adhanom Ghebreyesus told the world that COVID-19 could now be characterized as a pandemic, noting at the time that the number of cases outside China had increased 13-fold over the preceding 2 weeks. That same week in March 2020 became, for much of the world, the moment the pandemic stopped being a distant news story and became immediate, personal reality. Italy, hit early and extraordinarily hard, imposed a national lockdown on March 9th, the first Western democracy to do so, as hospitals in the northern region of Lombardy became overwhelmed, forcing doctors into agonizing decisions about which patients could receive scarce ventilators and intensive care beds. Images of military trucks in the city of Bergamo transporting coffins because local funeral homes and crematoriums could no longer keep pace with the dead became some of the defining images of the pandemic's early months. In the United States, President Donald Trump declared a national emergency on March 13th, 2020. Within days, schools, restaurants, and businesses across dozens of countries shut their doors, and a phrase almost no one had used before, social distancing, entered everyday vocabulary worldwide. In the United States, the early weeks of the outbreak were compounded by a significant and consequential failure. A defective test kit distributed by the Centers for Disease Control and Prevention in early February 2020 produced unreliable results in many state laboratories, forcing a delay of several critical weeks before widespread testing became available. A gap that public health experts would later point to as allowing the virus to spread undetected across American communities during a window when early containment might still have been possible. The Trump administration did restrict travel from China in late January 2020 and later from parts of Europe in March. Moves the administration highlighted as early and decisive action, even as critics noted the restrictions came after the virus had already begun spreading within the United States through other pathways, and that domestic testing and containment measures lagged well behind the travel restrictions themselves. Governments moved simultaneously to blunt the pandemic's economic shock. In the United States, Congress passed the CARES Act in March 2020, an emergency relief package worth over $2 trillion, providing direct payments to individuals, expanded unemployment benefits, and loans to businesses struggling under lockdown conditions. One of the largest economic relief measures in American history, followed by additional relief packages over the following year as the crisis continued longer than many initial responses had anticipated. Similar emergency spending programs were enacted by governments across Europe and much of the wealthier world, propping up economies that had, in effect, been deliberately and abruptly shut down in the name of public health. An unprecedented policy experiment whose long-term economic consequences, including the inflation that followed in 2021 and 2022, economists would spend years afterward still working to fully untangle. Governments around the world adopted dramatically different strategies in those early months, reflecting different political systems, healthcare capacities, and public health philosophies. China maintained an aggressive zero-COVID strategy for years, relying on strict lockdowns, mass testing, and digital contact tracing to stamp out outbreaks wherever they appeared. New Zealand, under Prime Minister Jacinda Ardern, closed its borders early and pursued a similarly strict elimination strategy, achieving long stretches with no community transmission at all. Sweden, by contrast, became internationally notable for largely avoiding mandatory lockdowns, instead relying on voluntary guidelines and public trust. An approach led by state epidemiologist Anders Tegnell that drew both praise for preserving normal life and sharp criticism over its comparatively higher early death toll among elderly Swedes. The United Kingdom, under Prime Minister Boris Johnson, initially considered a more limited approach before reversing course and imposing a full lockdown in late March 2020, a decision made in the shadow of modeling produced by epidemiologist Neil Ferguson at Imperial College London, projecting catastrophic death tolls without stronger intervention. Johnson himself would be hospitalized with severe COVID-19 in April 2020, spending time in intensive care. One of the highest profile world leaders to fall seriously ill from the virus he was managing his country's response to. In the United States, the response became deeply entangled with an already polarized political landscape. Dr. Anthony Fauci, the longtime director of the National Institute of Allergy and Infectious Diseases and a key member of the White House Coronavirus Task Force, became one of the most visible and, over time, most politically contentious figures of the entire pandemic, praised by many for his steady public health messaging and criticized by others, including at times President Trump himself, over disagreements on issues ranging from mask guidance to the pace of reopening the economy. Dr. Deborah Birx served alongside Fauci as the task force's response coordinator. Debates over lockdowns, mask mandates, and eventually vaccines became flashpoints in American political life in a way that few public health issues had been before. With the same masks and closures that were treated as basic precautions in much of the world becoming, in parts of the United States, subjects of intense ideological division. Healthcare workers around the world found themselves on the front lines of a crisis for which the world was, in critical respects, unprepared. Hospitals in hard-hit regions faced severe shortages of personal protective equipment, forcing doctors and nurses to reuse masks designed for single use, or in some documented cases, to fashion makeshift protective gear from garbage bags and other improvised materials. Ventilators, ordinarily used for a small fraction of hospital patients, became desperately scarce resources in overwhelmed intensive care units in cities including New York, Milan, and later Mumbai and Manaus, Brazil. Nightly rituals of applause for healthcare workers from the balconies in Madrid, Rome, London, and New York became one of the pandemic's more unifying early symbols, even as the workers being applauded faced exhaustion, trauma, and in devastatingly high numbers, infection and death themselves, with the World Health Organization later estimating that many thousands of health and care workers died from COVID-19 in the pandemic's early years. As 2020 wore on, scientific attention turned urgently toward a vaccine, and what followed became one of the most remarkable achievements in the history of medicine. The development of safe and effective vaccines in under a year, a process that had historically taken a decade or more for any previous disease. Multiple approaches raced forward simultaneously. In Germany, a small biotechnology company called BioNTech, founded by a husband and wife team of immunologists, Ugur Sahin and Özlem Türeci, both children of Turkish immigrants, had been working for years on messenger RNA technology, originally with cancer treatment in mind, before pivoting their research toward a coronavirus vaccine within days of the virus's genome being published in January 2020. BioNTech partnered with the American pharmaceutical giant Pfizer to develop, test, and manufacture the vaccine at global scale. In the United States, the biotechnology firm Moderna pursued a parallel path, using the same underlying messenger RNA technology, while the United Kingdom's Oxford University partnered with the pharmaceutical company AstraZeneca on a more traditional viral vector vaccine, led by vaccinologist Sarah Gilbert. In October 2020, in one of the more startling developments of the American election year, President Trump himself tested positive for COVID-19, along with First Lady Melania Trump and several senior aides, following a series of campaign events and a White House gathering later linked to a cluster of infections. Trump was hospitalized at Walter Reed National Military Medical Center for several days, receiving an experimental antibody treatment not yet available to the general public, before returning to the White House and resuming an active campaign schedule within a matter of days. A recovery he presented publicly as evidence the virus could be overcome, even as his own infection underscored just how difficult the virus had proven to contain even at the highest levels of government. As vaccines became available in late 2020 and through 2021, uptake was complicated in many countries, and particularly in the United States, by significant and often highly organized vaccine hesitancy and misinformation, spreading rapidly across social media platforms and encompassing everything from exaggerated claims about vaccine side effects to broader conspiracy theories about the pandemic's origins and purpose. Public health officials found themselves fighting a parallel battle against misinformation, even as they raced to distribute doses, and vaccination rates ultimately varied enormously along political, regional, and demographic lines within the same countries. A divide that public health researchers would later link to measurably different rates of severe illness and death between more and less vaccinated communities during the pandemic's later waves. The United States government, under an initiative called Operation Warp Speed, launched in May 2020, committed billions of dollars to accelerate vaccine development, testing and manufacturing simultaneously rather than sequentially, a financial gamble that allowed companies to begin producing millions of doses of candidate vaccines even before clinical trials confirmed whether they worked, a calculated risk that would pay off spectacularly. In November 2020, within the same extraordinary week, both Pfizer and BioNTech's vaccine and Moderna's vaccine reported preliminary trial results showing around 95% efficacy at preventing symptomatic COVID-19. Results that stunned even many scientists closely involved in the effort, given that a seasonal flu vaccine achieving 50% efficacy is typically considered a good result. The Pfizer-BioNTech vaccine received emergency authorization in the United Kingdom on December 2nd, 2020, becoming the first COVID-19 vaccine authorized for public use anywhere in the world, with the United States following with its own emergency authorization on December 11th, and vaccination campaigns beginning within days, prioritizing healthcare workers and the elderly first. The rollout that followed exposed stark global inequalities that would shape the pandemic's middle years. Wealthy nations, having placed enormous advance orders with vaccine manufacturers even before trial results were known, secured the overwhelming majority of early doses, while many lower-income countries waited months or years for meaningful vaccine access, a gap that the World Health Organization's COVAX initiative, designed to promote equitable global distribution, only partially closed. By the end of 2021, many wealthy nations had offered booster doses to much of their adult population, while significant portions of the population in parts of Africa and South Asia had not yet received a single dose. A disparity that public health experts warned, correctly as it turned out, would allow the virus continued opportunity to spread and mutate largely unchecked in under-vaccinated regions. And mutate it did. The virus that emerged from Wuhan in late 2019 did not remain static, and as it spread through billions of human infections worldwide, it generated a series of new variants, several of which reshaped the pandemic's course. The Alpha variant, first identified in the United Kingdom in late 2020, spread more easily than the original virus and drove a severe winter surge across Europe and North America. The Delta variant, first identified in India in late 2020 and dominant by mid-2021, proved considerably more transmissible still and caused a devastating wave of illness and death in India during the spring of 2021. With crematoriums in cities including Delhi operating around the clock, and hospitals turning away patients for lack of oxygen. Images that shocked the world and underscored how far from over the pandemic remained, even as vaccines became available elsewhere. Then in November 2021, scientists in South Africa, working in laboratories led by researchers including Tulio de Oliveira, identified an alarming new variant, Omicron, carrying an unusually large number of mutations that allowed it to partially evade immunity from both prior infection and vaccination. Omicron spread faster than any previous variant, causing an enormous global surge in cases through the winter of 2021 into 2022, though it generally, though not universally, caused somewhat less severe illness than earlier variants. A shift that many scientists believed reflected some combination of the variant's own biological characteristics and the accumulated immunity of a global population that had, by that point, experienced 2 years of infections and vaccinations. The pandemic's toll, in the end, proved almost impossible to measure with full precision, a reflection of inconsistent testing, reporting, and record-keeping across different countries and different points in the crisis. Official reported deaths attributed directly to COVID-19 surpassed 7 million people worldwide by the time the World Health Organization ended the pandemic's status as a global health emergency in May 2023. But excess mortality studies, which compare total deaths during the pandemic period against historical averages to capture deaths that may not have been formally attributed to COVID-19, suggested the true toll was considerably higher, with estimates from organizations including the World Health Organization placing global excess deaths associated with the pandemic somewhere between 14 and 18 million people through the end of 2021 alone, a scale of loss that places COVID-19 among the deadliest pandemics in recorded human history, alongside the 1918 influenza pandemic and the Black Death of the 14th century. Beyond the direct medical toll, COVID-19 reshaped daily life and the global economy in ways that outlasted the acute emergency itself. Hundreds of millions of students worldwide experienced extended school closures with lasting and still-studied consequences for learning loss, particularly among children from lower-income households with less reliable access to the technology needed for remote learning. Remote work, adopted rapidly and out of necessity by office workers across the world in the spring of 2020, permanently altered workplace norms for millions of people well beyond the pandemic's acute phase. Global supply chains, stretched by factory shutdowns, shipping disruptions, and shifting consumer demand, contributed to a period of significant inflation that persisted in many economies for years after the initial health crisis had eased, and a phenomenon that came to be known as long COVID, in which a meaningful share of those infected experienced lingering symptoms including fatigue, brain fog, and shortness of breath for months, or, in some documented cases, years after their initial infection, emerged as an ongoing public health challenge that outlived the pandemic emergency itself and remains even now an area of active medical research. One question about COVID-19 has remained genuinely, formally unresolved since the pandemic's earliest days: the precise origin of the virus itself. Two competing hypotheses have dominated scientific and political discussion. The first, favored by many virologists and supported by analysis of the earliest known cases clustering around the Wuhan seafood market, holds that the virus most likely emerged naturally, jumping from an infected animal to a human, similar to the way earlier coronavirus outbreaks, including the original SARS, are believed to have originated potentially through the wildlife trade that supplied live animals to markets like the one in Wuhan. The second hypothesis holds that the virus may have instead escaped, whether accidentally or through some other pathway, from a research facility in Wuhan, the Wuhan Institute of Virology, which was known to conduct research on bat coronaviruses, a possibility that gained increasing attention and support from a number of intelligence agencies and scientists in the years following the pandemic's onset. Both hypotheses remain actively debated among scientists and intelligence agencies to this day, with different government assessments, including differing conclusions reached by various United States intelligence agencies, reflecting genuine underlying uncertainty rather than settled consensus. An uncertainty compounded by China's limited cooperation with international investigators seeking access to early samples, records, and laboratory data in the crucial early period when such evidence might have been most conclusive. The pandemic also left behind a complicated legacy for the institutions that led the global response. The World Health Organization faced criticism from multiple directions, from those who felt it acted too slowly and too deferentially toward China in the outbreak's earliest weeks, to those who felt international cooperation however imperfect, remained essential and was undermined by nationalist responses, including vaccine hoarding by wealthy nations. The United States, under President Trump, formally announced its withdrawal from the World Health Organization in 2020, a decision reversed by his successor, President Joe Biden, upon taking office in January 2021, illustrating how thoroughly the pandemic response had become entangled with broader questions of international relations and domestic politics that extended well beyond public health itself. By May 2023, with global vaccination widespread, treatments improved, and population immunity, whether from vaccination or prior infection, substantially built up worldwide, the World Health Organization formally declared an end to COVID-19's status as a public health emergency of international concern. A designation Director General Tedros Adhanom Ghebreyesus noted did not mean the disease itself had disappeared, but that the extraordinary global emergency phase had passed. The virus that first appeared in a handful of pneumonia patients in Wuhan in December 2019 had, in the space of roughly 3.5 years, infected hundreds of millions of confirmed cases worldwide, killed millions, upended the global economy, reshaped how much of the world works, learns, and gathers, and left behind a complicated inheritance of scientific achievement in the astonishingly rapid development of effective vaccines, alongside deep and lasting questions about global cooperation, institutional trust, and preparedness for whatever pandemic the world might face next. Dr. Li Wenliang, whose early warning was silenced before it could be heeded, did not live to see any of what followed, but his name remains, for many, the very first chapter of a story that would go on to touch nearly every person alive on Earth. The COVID-19 pandemic will be remembered as one of the defining events of the 21st century. It claimed millions of lives, changed the way we work, learn, travel, and connect with one another, and reminded the world how quickly life can change. Even today, some questions remain unanswered. New research continues to emerge, and historians and scientists are still studying many parts of this extraordinary chapter in human history. Like every event we cover on this channel, our goal is not to tell you what to think, but to present the story as accurately as possible and let you form your own conclusions. Now, we'd like to hear from you. What moment from the COVID-19 pandemic do you remember the most? And what lesson do you think humanity should carry into the future? Share your thoughts in the comments. And if there's another historical event you'd like us to cover, let us know. Your suggestions help shape future documentaries on the Retro Review. If you enjoyed this documentary, don't forget to like, subscribe, and join us for our next journey through history. Until next time, thank you for watching.